Today we're going to discuss breast cancer since October is Breast Cancer Awareness Month. Okay, so we're going to look at the definition of breast cancer, the signs and symptoms of breast cancer, the risk factors, and prevention. So what is breast cancer? Breast cancer is a disease in which the abnormal breast cells grow out of control and form tumors. If left unchecked, these tumors can then spread throughout the body. Breast cancer is the second most common cancer diagnosed in women, and from our Namibian National Cancer Registry, it shows that each year, or 549 cases of breast cancer are being diagnosed each year. Now, if we look at the symptoms, we're going to look at this little diagram over here. You will feel a lump in the breast, and if you press on this lump, it might feel a little bit tender or a little bit painful. There can be hardening of the breast skin. There might be a sore that's not healing or that's taking a little bit longer to heal. There can be discharge from the nipple. Discharge is usually a little bit bloody. There can be a depression or pull in the skin of the breast, or the nipple can be inverted. What are the risk factors? Okay, one thing to remember is even if you have one or several of these breast cancer risks, it doesn't necessarily mean that you will develop breast cancer. Okay, so female puts you at risk of developing breast cancer if you're taking any hormonal therapy, when you are overweight, when you're above the age of 50, you have a higher risk, taking alcohol in excessive amounts. If you are smoking can increase your risk of getting breast cancer by 10%. Okay. Our genetics, if there's somebody in our family, a grandmother, an aunt, great-grandmother, diabetes, being exposed to radiation, and getting pregnant at an older age. Getting your menstruation at an earlier age, usually before the age of 12 years, or if you go into menopause at a later age as well. Some of us might have higher density in our breasts. This can also increase the risk of us developing breast cancer. What can we do to prevent this? Okay, so ask your doctor about the breast cancer screening. Exams and tests that you can do, like your breast exam, self-breast exam, and going for a mammogram. Discuss about the benefits and the risk of the screening, and together you can decide on what is the best way in terms of what test, and according to your age as well, will be best and the right way approach for you to do. Becoming familiar with your breast through a breast self-exam will make you more aware. If there's any new change, if there's a lump or unusual signs in your breast, talk to your doctor as soon as possible. And breast awareness can prevent breast cancer, but it may help you to better understand the normal changes that your breast undergo and identify any unusual signs and symptoms. Drink alcohol in moderation and exercise more frequently. Once again, learn your family history of breast cancer. Tell your doctor about your family history. Ask if you need to go for any genetic counseling or any genetic test. And build those healthy habits, like maintaining a healthy weight, exercising regularly, eating a lot of fruit and veggies, avoiding any hormonal therapy if possible. Most importantly, get regular breast cancer screening done and limit your alcohol. Early detection saves lives. So the earlier that you pick up anything that's wrong in your breast, the better the outcome will be. Thank you.